what factors are you looking at in determining whether he was dependent on opioids? What are the things that you see in these medical records which cause you to believe that?
6 weeks of very frequent high-dose use, I believe, would result in opioid dependence in any of us.
And you would consider this very high use?
Very high.
Let's go. Can you direct your iPad to the next day, May 5th?
Yes.
You see on May 5th he received 200 milligrams?
10:30 a.m. Demerol, 200 milligrams, and midazolam, 1 milligram IM, right upper quadrant. 12 p.m. Demerol, 100 milligrams, midazolam, 1 milligram IM, left upper quadrant, I believe.
On May 5th, he received a total of 300 milligrams of Demerol.
Correct.
2 milligrams of midazolam.
Correct.
What about May 6th? We see a notation underneath. May 6th, how much of the drug did he get?
300 milligrams of Demerol in 2 separate doses, total 300, and another 2 milligrams of midazolam, again in 2 1 milligram doses.
In all of these medical records that you have reviewed so far, do you see any notation in them from a doctor?
I do not.
These are notations from whom, you understand, from the records?
Sustained.
What makes you think that they're...
Motion to strike the previous answer. This witness has no idea.
The objection is sustained. The reference to no notations from a doctor is stricken. Disregard that. Absent further foundation.
How do you know there's no notations from a doctor?
Well, that assumes facts not in evidence because I just struck out the last answer. You can rephrase the question.
Well, okay. Well, my first question is: do you know whether there are any notations from a doctor in these medical records?
My review and my belief is that there aren't any.
All right. How do you know?
Just a moment, please. Overruled.
How do you know?
I don't see any signatures, and I don't see his initials.
Objection.
Overruled. Counsel can inquire further.
So in May 6th, we have 300 milligrams of Demerol that was provided. Is that correct?
Correct.
And on May 5th, another 300 milligrams.
Correct.
And you have testified that on May 4th, 300 milligrams were provided. Is that right?
Correct.
So in 3 days, Michael Jackson received 900 milligrams of Demerol.
Correct.
We'd like to go to May 19th and May 20th. Now there
Yes.
are, do you have that?
I do.
Now, you would agree with me that in these medical records there's a large gap of time between May 6th and May 19th where nothing was going on in the medical records, right?
Correct.
And we see on May 19th that Michael Jackson received 200 milligrams of Demerol and a milligram of Versed, it says.
Correct.
What is Versed?
Versed the generic name for midazolam.
Okay. And now on the 20th, the next day, he received 200 milligrams of Demerol and a milligram of Versed. Is that right?
Correct.
Let's go to the next day that's reflected in the notes, which is May 21. It shows 100 milligrams of Demerol and 1 milligram of midazolam. Is that right?
Correct.
And then in these medical records, you see very next entry would be June 1st of 2009. Is that right?
Correct.
It shows 200 milligrams of Demerol and a milligram of midazolam.
Correct.
All right? And then as we proceed in these medical records, the next entry shows June 3rd, where we have 200 milligrams of Demerol, 2 milligrams of midazolam. Is that right? The next entry is June 9th, which shows 200 milligrams of Demerol, 2 milligrams of midazolam. Is that correct?
Correct.
The next entry in the medical records that we have is June 16th,
Correct.
which shows 100 milligrams of Demerol and 1 milligram of midazolam, right?
Correct.
And June 22nd, which shows 100 milligrams of Demerol and 1 milligram of midazolam. Is that right?
Correct.
When an individual is addicted to opioids, painkillers, what types of problems, other than what types of physical problems are caused or manifested by that addiction? What complaints do you see when somebody is addicted to opioids?
While they're actively using,
You said that opioids have a tendency to hypersensitize certain bodily functions. Is that right? You have a rebound effect?
withdrawal from opioids tends to result in overactivity of some body functions.
All right. What is the biggest problem you experience with these patients as you go through that?
Anxiety, restlessness, insomnia.
And
May we remove the exhibit? If you're done.
Okay. Well, actually, I'm done for now, Judge.
Thank you.
You mentioned insomnia. Is that a common complaint that you receive?
Very common.
How common?
Virtually, in withdrawal, virtually every patient experiences sleep disturbance. And it's of varying degrees of severity. Again, a very individualized phenomenon, very idiosyncratic, but basically universal.
All right. And when you say varying degrees, is it the type of problem insomnia that could be chronic, daily?
Daily, intermediate in term, not possibly more chronic. You would expect it to last weeks to months. That's what I usually advise my patients.
If an individual is going through a withdrawal from Demerol, you've already told us what the symptoms of that is. What is the simplest way, or what is the easiest way to provide relief for these withdrawal symptoms?
Again, it requires multiple medications, but treating the anxiety with benzodiazepines, treating providing antidiarrheals, providing sleep medications, all of the above are required.
Treatment. I'm asking you, what's the simplest way to end withdrawal symptoms?
So provide an opiate.
If a particular individual is addicted to Demerol and withdrawing, what would be, and he were to receive a shot of Demerol on the 22nd, would that relieve, assuming he was withdrawing on the 21st, would that relieve his symptoms?
I would expect that, again, to varying degrees, you might get some relief, you might get an intermediate amount, you might get long-lasting relief, but I would expect certainly some response with respect to reduction in symptoms from the dose.
And at some point, if he did not receive any more Demerol, assuming an addiction, the withdrawal symptoms would set in again?
If a given individual was physically dependent and did not receive any opioid, it wouldn't have to necessarily be the opioid of common or ongoing use. Any opioid might be anticipated to relieve a good deal of the symptoms.
All right, well, I want you
In
to
fact, just in my practice, many patients, when they can't get their opiate of choice, will use other opiates.
Well, I want you to assume that a particular individual was addicted to Demerol and was suffering from withdrawal symptoms on June 21st, 2009. I want you to make that assumption for this hypothetical, all right?
Yes.
Would a shot on the 22nd relieve those symptoms? Would you expect that to relieve those symptoms?
It would absolutely help. To what degree, you wouldn't know until you administered it.
All right? And at some point, as the days progressed, if that particular individual who was addicted did not receive any more Demerol, would you expect symptoms of withdrawal to recur, to come back?
Yes.
All right. And you've testified that that could occur in 12 hours, 24 hours, maybe it could reach its peak in 3 days, 72 hours. Is that right?
It would really depend upon the amount of use prior to the cessation, the dose, the frequency, etc.
It varies.
It's very variable.
All right. Thank you. I'll pass the witness.
Mr. Chernoff, thank you. This will be cross-examination by the people. Mr. Waldman?
Thank you, Your Honor.
Thank you. Dr. Waldman, you want some water?
Water, may I?
Yes. Give us a moment, please. May we bring in some water, please?
Thank you.
You're welcome. Mayor, Deputy Jones, thank you.
Thank you.
You're welcome. You let us know when you are able to resume, sir.
I'm ready.
Thank you. Mr. Walgren,
Thank you, Your Honor.
you're welcome.
Good morning, sir.
Good morning.
Dr. Waldman, did you write a report in this case?
I did not.
You didn't write a report at all?
No.
Double negative?
There's no report you created to turn over to the people for discovery?
None whatsoever.
One can be addicted to benzodiazepines, correct?
Yes.
Lorazepam is a pretty powerful Schedule IV benzodiazepine. It's actually regulated by the Drug Enforcement Agency, correct?
Which one are you, which benzodiazepine?
Lorazepam.
Lorazepam. I honestly don't know what schedule it is, but it requires a appropriate triplicate prescription to write.
Doesn't your drug addiction specialty, isn't one of the things you do is pharmaceutical addiction?
Absolutely.
Okay. And lorazepam's a pharmaceutical?
Absolutely.
Okay. Would you agree that it's a scheduled controlled substance regulated by the Drug Enforcement Agency?
Yes.
And it's a highly addictive drug, isn't it?
Yes.
Which documents did you review in this case? I understand you reviewed Dr. Klein's medical records, and you just referenced other records, but what were they?
I reviewed the autopsy,